Rajendra and Sanjay, and thank you for that lovely introduction, for having me here today. I'll be talking about the management using non-drug approaches for common mental health problems. So the main areas that I'll focus on is anxiety and depression, and what I'll be doing is focusing from the scientific evidence, and you'll be quite surprised to know that there's actually a lot of evidence in this area. Together with Professor Abhisali and Louis Vitetta, we have written a book, and as Dr. Nagendra said, there are thousands and thousands of research papers in this area, in yoga and many other non-drug approaches. This is our textbook, if anyone's interested, to have a look at it. But also we've got flyers outside with a discount if you're interested in purchasing the book. So what I'm going to do is focus on the scientific evidence, and I'm using some abbreviations. MA stands for meta-analysis, SR for systematic reviews. What these are looking at randomised controlled trials. They're our gold standard trials that we do in Western medicine. And when there's more than one randomised controlled trial, the scientists collate that information together and they come up with a conclusion. When there are trials over more than one randomised controlled trial and there's a systematic review or a meta-analysis, it's given a level 1 evidence. And in Western medicine, that's considered gold standard, top medicine. And I'm going to be focusing on the level 1 evidence or randomised controlled trials, the level 2 evidence. So RCT stands for randomised controlled trial. And when it's compared with a placebo, it'll be a randomised placebo-controlled trial or a double-blind randomised placebo-controlled trial. So this is the classification for scientific evidence in Western medicine that we consider gold standard is a level 1 and level 2. And they're the areas that I'm actually going to focus on for the non-drug approaches. Now, just to let you know that there's a lot of information I have on these slides. I'm not going to read them word to word, and you're welcome to copies of these slides. So, for example, there'll be dosages, things like that. I'm just going to skip those slides and just ask Rajendra for a copy of my slides, and you can look at them in your own time. And it's all from the textbook as well. This is from the textbook. Depression, there's actually a number of research showing that, for example, exercise is level 1 research, cognitive behaviour therapy, level 1 research, meditation and relaxation, level 2 and 1, music therapy, level 1, yoga, level 1, bright light therapy, sleep therapy, St. John's wort, SAMI, fish oils, folate, tryptophan and zinc, all have level 1, and I'm going to talk about all of these today. Also, even a multivitamin, vitamin Bs and vitamin D randomised controlled trials show that they help depression. Even in anxiety, we've got exercise and cognitive behaviour therapy, level 1, reading books, especially self-help books, dance therapy, level 1 evidence, lower evidence for hypnosis, but I personally find hypnosis can help anxiety. Music therapy, level 1 evidence, the number 2 is a mistake there. Relaxation therapy, even Reiki, acupuncture, level 1. Aromatherapy and massage, randomised controlled trial. Yoga, randomised controlled trial. Using the herb kava and sage is level 1 evidence. The other herbs, passiflora, level 1, although it was mixed. And with valerian, there's a randomised controlled trial. And finally, fish oils, magnesium, melatonin have been shown to also help anxiety with a randomised controlled trial. So these are all the studies. That was a summary of all the studies that exist, but I'll actually go through some of those studies with you. If you were to take home one bit of information today, this is the most important slide. Because what we found is that it doesn't matter what disease you have, if any patient creates positive lifestyle changes, they're going to feel better no matter what disease that they have. And that includes mental illness. So eating a diet that's rich in vegetables and fruit, fish, nuts, seeds, legumes, restoring sleep, exercising every single day, especially with nature, sunshine exposure, rest, relaxation, stress management, listening to music, having counselling if you're experiencing stress or worries, being part of a support group, religion, spirituality, and looking at the environment and avoiding chemicals. These basic behavioural lifestyle changes will impact on everybody's mental health, no matter what disease they may have. This is fundamental to healing. So let's start with the evidence, and as I mentioned, I'm just going to skip through these slides because I'd actually like to play you all a song at the end if I get time. Alright, so the first one is counselling and cognitive behaviour therapy is level 1 evidence. There are 4 randomised controlled trials saying that this is gold standard. If anyone has anxiety or depression, it is so important to start with this first. This is mainstream medicine, so there's nothing complimentary about this. Sorry about that. Go back. Same with anxiety. There are review papers that number 1 has to be cognitive behaviour therapy. I didn't find any systematic reviews, but I would think that that's most important. What's most important is that people live what's true to their lives, whether it's just changing a part of their lives or a whole of their lives. So if it's work that's stressing people out, it may be work that they have to change, either reducing their hours, reducing their workload, or finding another job. So if the most important part of mental health is actually doing what's right for you and creating whatever life changes are necessary. Now, religion and spirituality are most important. There's very good evidence. This is actually level 1 evidence to show that being religious or being part of a spiritual group lowers depression over time. Group therapy and support groups are most important. This is a big study done in 63 adolescent children who were suffering from repeated self-harm of cutting themselves and depression. And they randomised them to a weekly group therapy program or just doing the usual counselling. The ones that were in the group therapy program, so being part of a group where they feel supported, that they're not alone, that they're connecting with other children, teenagers with the same problem, were less likely to harm themselves, less likely to use healthcare resources, were more likely to attend school, and had less rate of behavioural disorders. Relaxation therapy, there's a Cochrane review and level 1 meta-analysis of 11 randomised controlled trials showing that it helps depression. Meditation, there's a review study that found that mindfulness-based cognitive mindfulness-based cognitive therapy is strongly recommended for unipolar depression. That's better. I can hear myself now. That's good. And that both mindfulness-based stress reduction and cognitive therapy is useful for anxiety. And of course also for pain management. Exercise is most important. This is me walking along the beach, and that's why I came a little later, because no matter what, I always walk every morning along the beach because of nature. And it's actually my antidepressant. It's what keeps me going, keeps me happy, makes me feel emotionally good. And I think it's essential that we all do this every day, not 3 times a week, 4 times a week, or once a week because it's been raining all week. No matter what the weather is, it's so important we get out for a walk. Now, the good news is it's actually level 1 evidence to show that walk a day helps depression. Now, what's interesting, one of these studies, one randomised controlled trial that was here in this level 1 systematic review, compared exercise with taking the Prozac tablet. And what they did in this study, this is just looking down, but that's okay. What they did in this study is that they compared the 2 groups, and they said to one of the groups, okay, every morning you go for a walk, and this one here, we'll put these patients onto Prozac. And then after a few weeks, they compared their mood levels. Now, the score was exactly the same, improvement in moods and reduction in depression in the 2 groups identical. Now, what's interesting, at the time when this study was done, it got published, it was in the British Medical Journal, very highly reputable journal. At the time, my husband's cousin was the director of the Prozac company. And I said, I know. And we got together for Christmas, and I said to him, look, did you hear about this study that showed that exercise was equally effective to Prozac? And he said to me, yeah, I'm aware of that study. And I said, do you show doctors that study when you go do the pharmaceutical rounds and the sponsorship? And he said, no, that's the one we put underneath the cupboard. So you've got to be aware of research in drug therapy, because the negative results, or the ones where they show, for example, exercise is equally effective, are the ones that doctors don't see. Except people like me, and I'll let people like you know. All right, what about anxiety? Yes, there's level 1 evidence there as well. Sunshine? Yes, there's level 2 evidence to show that full sunlight is an antidepressant. When it's a blue sky day, we all feel happy, don't we? There's just this kind of feeling of happiness that comes amongst all of us. And I know when it's a full sunshining day and I'm working, patients come in with a smile, and it just makes such a big difference. Obviously, full sunlight is preferred. There are light boxes out there. There's a randomised controlled trial showing light boxes. I'll just show you the next photo. Can help. And these you can buy from Amazon, on the internet. You can put them underneath your computer and shine it, particularly for office workers who are indoors all day and they don't have time to go out and get some sunshine. And that can make a difference to depression and improve mood. There was one study, a randomised controlled trial, and that's why it's level 2, that found that using the light box was actually equally effective to fluoxetine and a common antidepressant. So it would make sense that rather than using the drug, it might be better to use a light box. Now that was for winter seasonal affective disorder. So when we're depressed in winter time, there are patients who feel very depressed. Obviously going out and getting the sunshine is the solution. So it's a bit slow. There you go. And they're all the references, and you'll have access to all these studies. What about non-seasonal depression? So depression outside of winter, for example, in summertime. There are over 20 studies, so level 1 evidence showing that... Yep, hold it in my hand. Okay. I don't mind pushing it up with this. All right. Oh, that's good. Oh, that's much better. Okay, there's level 1 evidence showing that bright light therapy can also help non-seasonal affective disorder or depression. Now, vitamin D deficiency is a risk factor for depression. So it's worthwhile for patients who are depressed to go and get their blood levels done for vitamin D. There's research to show that if your vitamin D level is down, you're more likely to feel depressed. Now, there's a couple of studies, randomised controlled trials, level 2, that show that even supplementing a low dose of vitamin D, and in this case, this is in 51 Canadians with depression, and they supplemented them with a low dose of vitamin D, 600 international units, or a high dose vitamin D, 4,000 international units, and found that both groups equally improved their mental well-being. In this study, they were actually studying obese patients and the risk of osteoporosis, but they were also looking at mental health with the supplementation of vitamin D. And so it was what we call a secondary endpoint. The first one that they were looking at was the risk of falls. If vitamin D reduced the risk of falls, and interesting, in this study, it made no difference after 1 year. But what they found as a consequence of taking high-dose vitamin D, in this case 20,000 or 40,000 international units per week for 1 year, there was much less depression in the patients taking vitamin D. Yoga, good news, there's level 1 evidence to show that it improves depression. There's actually 3 level 1 studies here, systematic reviews. The first one is of 12 randomised controlled trials of women with breast cancer. And they went through an active yoga treatment, and they noted improved moods, coping, improved psychological health, and reduction of stress. Another systematic review of 12 randomised controlled trials, this is a different study with different authors, showed that yoga also improved moods and reduced depression. There was another study in patients with schizophrenia, and they said that it didn't actually improve the schizophrenia symptoms, but it did improve the quality of life of the patient suffering schizophrenia. Now, sleep is most important. This is my daughter, Sleepy, and this is about 10 years ago. She's actually a big teenager now, nearly 15 years old, and she doesn't know that I show this to everybody every time. I just love the slide. And she used to sleep with me too for many, many years. Such a delight. Okay, and what the studies have shown that if our sleep is disturbed, that we're also more prone to depression, which is the other way around. We know that people with depression suffer poor sleep, what we call early morning awakening or difficulty getting to sleep. But it's also the other way around. And this is a local study done here in Melbourne of mothers, with newborn infants who suffered sleep disturbance because of their babies crying, and they had double the risk of postnatal depression. What they found, this is a systematic review, that if our sleep is too short, less than 6 hours, or we have trouble getting to sleep more than half an hour, or after half an hour we wake up more frequently, then we're more likely to feel fatigued and depressed the next day. So part of the treatment is to actually restore sleep, using behavioural and sleep advice, so telling patients to get to bed at the same time every night, exercise every day, because a morning exercise and seeing the sun to produce melatonin will help bring on sleep at the end of the day and bring on the soft lighting at the end of the day, maybe a bath with candles to help bring on sleep, and avoiding stimulants like caffeine. Melatonin supplements might help, tryptophan may help, valerian and hops herbs may also help as well. Smoking itself increases the risk of depression. This is a study looking at young teenagers, over 15,000 teenagers that they interviewed, and found that the ones who were smokers were 4 times more likely to be depressed. And this was taking out other cofactors. In other words, what they were saying was it wasn't the depression causing the smoking. They said it was a direct result of the nicotine affecting the brain causing depression. So encouraging young people to give up smoking. Now, diet and fish particularly, I'll just go back. Our best source of vitamins is from food, obviously. And our diet plays an important role on our mental well-being. Geez, I can hear much more clearly now, even myself, so this is good. All right, so studies have shown, population studies, that where the populations have more fish consumption in their diet, now it doesn't have to be fish, it's the omega-3s that are most important. So for vegetarians, there can be alternative sources of omega-3s, like chia seed, flax seed, there's also buckthorn plant. There's a whole range of food products that are rich in omega-3s. You're 30% less likely of developing a mental health problem. In this systematic review of a number of randomised controlled trials in 17 countries, found that in the countries with high omega-3 intake, there was much less prevalence of bipolar disorder or manic depression. Now, in this very large cohort study of 3,500 middle-aged people over 5 years, they found that people who eat more whole foods, more vegetables, fruits and vegetables, nuts and seeds, compared with people who ate more processed foods, very much like our Western diet, more sweetened desserts, fried food, processed meats, refined grains and high-fat dairy products, had less depression, were at lower risk of depression. This may explain why we're seeing a rising incidence of depression in our Western society, with the junk food that all our young children are growing up with. I can't hear myself now. Has it gone down? Can you still hear me? Yeah? Okay, good. It's just changed a little. All right. This is also another study of young adolescents, over 7,000 of them, because it's a time of rapid brain development. This is the most important time to get young people onto a healthy diet to help prevent them from getting depression. Unfortunately, it's the teenagers who are more likely to resort to a junk food diet in Australia. But again, this study found that an unhealthy junk food diet made them more prone to depression. Again, this is an overseas study of nearly 9,000 Spanish people over 6 years, Again, they found the same finding: more fast food, more depression. So I think it's pretty clear that diet impacts our mental well-being. This is level 1 study now looking at fish oil supplements. The alternative being I provide buckthorn or flaxseed as the other alternative to omega-3 supplements. And there's level 1 studies to show that it improved depression in patients who take the supplements, the omega-3 supplements. So not only the diet, but also providing the supplements. And it needs to be EPA rich compared with the DHA. And it also improved bipolar disorder as well, stabilised bipolar. This is another level 1 study. Again, this is more current. This came out last year, of 29 randomised controlled trials showing that fish oils is better than placebo in improving moods. Now, what about anxiety? There is actually a small randomised controlled trial. This was tested in medical students, and they looked at inflammatory levels as well. And they found that apart from reducing inflammation, the fish oils also improved anxiety by a little bit, by 20%. So the benefits appear to be more for people with depression than for people with anxiety. Now, multi-B, vitamin Bs are really important in the biochemical process in the brain for the neurotransmitters and methylation of enzymes and biochemical pathways. Deficiency of vitamin Bs are common in the elderly, but also the elderly tend to eat fairly poorly, and it's not just the Bs, it's folate and other vitamins as well. And this very large study in America of patients above 65 years of age and over found that the ones that were taking, this is more the elderly, taking one multivitamin a day were less likely to get depression. And this is looking at over 3,500 adults. There's level 1 studies. This is a Cochrane review of, and that found that the elderly are prone to folate deficiency, but also that folic acid can be used for depression. But I never give folic acid on its own. I would give it as a multi-B. That's just a dosage. I'll let you look at that if you're interested. This is another study that 2 randomised controlled trials found that it's not just the folate, it's the methylfolate that helps with depression. Tryptophan is an amino acid, and it's used for the production of serotonin in the brain, which is one of the happy hormones, and also for the manufacture of vitamin B3. And there's research to show that it alleviates depression as well. Zinc is, there's a level 1 evidence systematic review that suggests that zinc can help depression as well. And I've actually seen this in clinical practice. Zinc is quite abundant, prevalent in the brain. It's a cofactor for a number of the neurobiochemical pathways. I'll let you look at that. The zinc picolinate is useful for depression, and that talks about dosage. SAMe is an amino acid found in all cells. Its other name is S-aminosyl-methionine, and it denotes a methyl group that's important for neurological function, and it plays an important role in mood regulation for neurotransmitter synthesis, and it needs vitamin B12 and folate. So SAMe should be given with a multi-B. And I find that it works much more immediately. Like within 24 hours, people feel a lot happier and come out of their depression fairly quickly. It's quite effective. The only problem with SAMe is that it's quite expensive. But what I do is I buy it at wholesale price, and I give it to patients at wholesale price, so it becomes a lot more affordable. There is level 1 evidence to show that SAMe was equally effective to tricyclic antidepressants for mild to moderate depression, and it can actually be used intravenously for severe depression. You don't do that in general practice. I've never done that, but I'm aware that there are psychiatrists now at Melbourne Clinic doing research on intravenous SAMe, which is an amino acid, and it seems to be fairly safe to take, but you don't use it in patients with bipolar because it makes you feel happy fairly quickly. It can actually make you manic as well if you suffer from bipolar disorder. Oh, I wanted to play some music. Is that a 5-minute warning or 1 minute? 2-minute warning, okay. All right, so what I'll do is skip a lot of slides here. This is the herb St. John's wort, and St. John's wort has level 1 evidence. This should be available on prescription for people. There's really a lot of evidence to show that it's equally effective to antidepressants for the treatment of depression with less side effects. Now, I'll let you have a look at that, but basically the one thing you don't do is you don't give St. John's wort with antidepressants because it interacts with a number of different medication. But if you're interested in reading up about that, it's all in the book or in my handouts today. Okay, and this is just a level 1 study that looked at overall all herbs and nutritional supplements and found in general that passion flower is good for anxiety, kava is good for anxiety, the amino acids lysine and arginine is good for the treatment of anxiety, and magnesium can also help as well. This is kava, and it's been traditionally used in the Pacific Islands. If you go to Fiji, you get to try a little bit of kava. Even our indigenous community, our Aboriginal community, using kava, and it can be used for anxiety. There's actually level 1 evidence to say that it actually is better than placebo. But what was interesting about this study is that the final conclusion, they said, oh, but maybe it's not so good. So it's all like the results were saying, no, it's really good, it works better than placebo. But then the researchers almost threw a little bit of biasness into the conclusion and said, oh, it's not so good after all. So anyway. All right, so kava, in the way that they give it in the Pacific Islanders and the way the indigenous people take it, can cause liver toxicity, so you've got to be careful. This is the herb called passiflora, and good news, there's a little bit of study to show that it helps with anxiety. I recommend it to patients to just buy it as a tea, passiflora tea. And in this one randomised control trial, it was equally effective to the benzodiazepines like Valium, which is good. And it's very safe to take, but their conclusion was, with the 2 trials, it wasn't enough to make a conclusion. Acupuncture, this is hot off the press, a very recent study that was just published showing a randomised control trial that even acupuncture can help depression. Now, finally, music. Is there good evidence for music in alleviating depression and anxiety? You tell me. Yes, good. You'll be pleased to know, yes, for anxiety, there's tons of research, particularly palliative care patients, people going through surgery, and now more and more hospitals and surgeons are using music therapy. And the other thing is it's also used for depression. Now, what I want to do is just do a randomised control trial with you guys. You guys are my experiment here. And I want you to think about your emotions in the last week. And if you've been through stress, if you've had a lot of difficulty maybe coming here, if you're feeling tired or your moods have been down, or if you've been good. And what I'd like to do now is to play some music for you and then check on your emotions afterwards. The thing about music is you don't have to do anything special. When I drive, doesn't matter where I drive, I enjoy driving because I listen to my favourite music. It's my opportunity to catch up with all my music. I cruise control, I put relaxing music on, and I can drive an hour to my farm with ease and happiness and love it because I listen to music. While we're cooking is the other opportunity as well, to listen to music. So it's nothing that you have to do anything out of your way, and it can have a profound effect on your emotions. Music has been traditionally used by many traditional cultures. Even our Indigenous community here in Australia use music through the didgeridoo for healing. And it's underestimated as a powerful tool for impacting emotion. So I've just picked one song now, and I thought I'd do it in context with my cultural background. I'll get you all to stand up and stretch. Give me a little stretch. I'll take this. Little stretch. Good. That's great. Shake. Shake. That's it. Listen up. And we're going to hear a song now and do whatever you feel like doing. Okay? We're waiting for it. No, it's the first track. Yes, please. Because I don't know how to use this. I think it's the first track. We'll see. Did you get the top right?
Yeah.
Okay. It should be the first track. Fingers crossed. And up loud. It says unknown artist. It's not recognising it. So hopefully I've got the right one. It should be the first one. So first one.
Sound is on. Sound up.
Yeah, first song.
playing?
Yeah, I played it at home, so I'll just... You might have to restart. That's it? Louder, louder. Start from the start. Oh.
It's connecting the wrong place.
Ah, it's not connected.
Speaker.
See how music makes us feel? It makes a big difference. Thank you, everyone.